that everything that we commit to NHS dentistry is spent on NHS dentistry, because we are in a mad situation now where demand for NHS dentistry is going through the roof, and yet we're having an underspend every year on the contract. So we've got to fix that. It's going to take some time to work that out with the British Dental Association, other key stakeholders. What is tragic about this situation is the party opposite had 14 years to fix this situation and left the situation in a terrible, terrible mess.
Laura Kirkspeth.
Please, Mr. Speaker.
Minister.
Thank you. I commend my honourable friend for her work on such an important topic, and I know it's very personal to her. Specialist perinatal and maternal mental health services are available across England, providing vital support to parents before, during and after pregnancy, including increased access to evidence-based psychological therapies. We are training thousands more midwives to better support women throughout pregnancy, with mother and baby units and community services providing postnatal support.
Laura Kirkspeth.
I thank the Minister for her answer. Tomorrow is World Maternal Mental Health Day, recognising the particular challenges that some mums face in this period from pregnancy through to birth and after birth. I commend the Secretary of State and his team for their rapid work to get the NHS delivering better for patients again. As they develop the 10-year plan for the NHS, can the Minister tell me more about what measures will be taken to ensure that all women, it's not this postcode lottery, but all women facing perinatal mental health challenges can access that right psychological support?
Well, I absolutely join with her in recognising the importance of supporting women's health throughout pregnancy and into parenthood on Maternal Mental Health Day. We are committed to improving the support available. It will form an important part of our 10-year plan. We're investing £126 million in family hubs and Start for Life services to support parents throughout pregnancy to early childhood, and we'll continue to work with her on this.
President Van Baalen.
Thank you, Mr. Speaker, and I thank the honourable member for her question and for the answer from the Minister. I'm delighted to be forming the all-party parliamentary group on fatherhood, and I'd also like the Minister to outline the steps she will be taking to improve perimental health for fathers as well.
Minister.
Well, I congratulate him on taking forward that work, and I know my friend, the Minister, will be very happy to continue to work with him on any way that we can to support the work. I think it's a really important aspect of parenthood.
Katie White.
Thank you, Mr. Speaker. Question number 9.
Minister.
Thank you, Mr. Speaker. We are already using technology to improve preventative healthcare and transform the NHS. We've invested £11 million in AI to trial breast cancer screening mammogram interpretation. We're piloting the NHS Health Check Online to tackle cardiovascular disease. And our NHS Better Health digital products, including the award-winning Couch to 5 app, were used by millions of people last year to tackle preventable conditions, and more will be included in the 10-year health plan.
ATY.
Thank the Minister. Leeds is leading the way in health tech, with Leeds Teaching Hospitals, the City Council, NHS Digital and firms like EMIS headquartered in Rawdon in my constituency, driving real innovation. How will the Secretary of State and his team ensure that Leeds is at the heart of the NHS 10-year plan so we can shift to prevention and spread the benefits to every corner of the UK?
Minister.
Thank you. I commend the work that my honourable friend refers to. The new Health Tech Innovation Hub, a flagship project of the West Yorkshire Investment Zone, brings together West Yorkshire Combined Authority and organisations like the Health Tech Leeds Partnership, academics, clinicians, policymakers, more than 250 health tech firms headquartered in the region, and they are already driving forward health innovation together. And as we've said before, Mr. Speaker, we must learn about the best of the NHS and take it to the rest of the NHS. The 10-year plan will shift to a model where the NHS focuses on prevention, with more services delivered in local communities through new technologies.
Alex Brewer.
Thank you, Mr. Speaker. One piece of technology that already exists that can prevent hydrocephalus is the humble tape measure. The Secretary of State has said he would ask NICE to conduct a review into the frequency of infant head measurements to detect hydrocephalus early. The charity Harry's Hat, based in my constituency, says this review isn't necessary, the evidence is already there. Will the Minister meet with me and the charity to discuss this further so that more infants' lives can be saved?
And in fairness, the Secretary of State did meet with them.
And has just told me, Mr. Speaker, what a wonderful charity they are. And I'll be more than happy to make sure that the relevant Minister meets with you to discuss, meets with the member to discuss that.
Gregory Stafford.
Number 10, Mr. Speaker.
Secretary of State.
Thank you, Mr Speaker. As the Prime Minister and I announced, NHS England will be brought back into the department to put an end to the duplication, waste and inefficiency resulting from two organisations doing the same job. The final nail in the coffin of the disastrous 2012 reorganisation, which led to the longest waiting times, lowest patient satisfaction and most expensive NHS reorganisation in history. Since the announcement, we've set up a joint board, assess resources and responsibilities across existing organisations, develop proposals on the role, functions and structure of the new centre and started detailed operational and legislative planning.
Stafford.
Thank you, Mr Speaker. The Secretary of State claims to support change, yet delays to the NHS reorganisation, including to the promised abolition of NHS England, suggest otherwise. Isn't the truth, as the Secretary of State outlined in his Guardian article, that he's bogging the system down in a slow, top-heavy restructure, while instead resorting to tax rises instead of delivering the decentralised, locally delivered, value-for-money healthcare that our constituents deserve?
Secretary of State.
Yeah, a lot of words and not a lot of sense, Mr Speaker. We are reforming the NHS and, as a result of these changes, redirecting hundreds of millions of pounds to the front line. And what is the Conservative Party's response to the abolition? The Shadow Chancellor of the Duchy of Lancaster said it could be a great thing, but it could be a total disaster. Will you let us know when they've made up their mind?
Anna Dixon.
Thank you, Mr Speaker. I would like to just make the point that the land review reforms which were implemented top-down by the party opposite, the idea that the NHS could ever be truly independent when it is there to serve us, the taxpayer, the general public. So will the Secretary of State agree with me that it is absolutely the right decision to move funding away from the centre to the front line to prioritise patients in the work that the NHS does?
My honourable friend has huge experience in this area and she is absolutely right. What we saw under the Conservatives was bloated bureaucracy, layer upon layer upon layer of checkers when we need more doers, and that is why frontline staff, patients and provider leaders all welcome the changes we are making so we can invest more into our frontline.
So, Secretary of State Adego.
Thank you, Mr Speaker. The Health Service Journal reports officials have acknowledged that the first draft of a high-level plan for merging NHS England and DHSC has now been delayed. When asking any written question about the merger, the standard answer seems to be, and I quote, "Ministers and senior department officials will work with the new transformation team at the top of NHS England, led by Sir Jim Mackey, to determine the structure and requirements needed to support the creation of a new centre for health and care." Even when asking a question specifically about the size of that transformation team itself, the answer is virtually identical. Either they willfully decide not to answer or they simply don't know. As with so many things, the government goes for the headline-grabbing announcement and talks the talk on reform, but without having done the actual work to deliver it. So my question to the Secretary of State is simple. When will that first high-level plan for the merger, with full assessment of costs and savings, be published?
Mr Speaker, honestly, he had his chance. He was the minister who took forward the last Reform Act of the last Conservative government, and he failed in that task. And now he turns up without a shred of remorse, without a shred of humility, attacking this government for cleaning up the mess they left behind. They're not a party of government. They're not even a party of opposition anymore. They are a total irrelevance.
Josh McAllister.
Question 11, Mr Speaker.
Minister.
Thank you, Mr Speaker. We are committed to fixing the front door of the NHS, including delivering the primary care infrastructure required to enable a neighbourhood health service. We've already taken steps to improve primary care infrastructure, including £100 million capital funding to upgrade GP buildings. We will set out how we will move to a neighbourhood health service in our upcoming 10-year plan following the spending review.
Josh McAllister.
Thank the Minister for her answer to that question. Workington suffers from some really poor health outcomes and has an incredibly fragmented health system. I've worked with local leaders in my constituency to pull together a plan for a new neighbourhood health centre called the Workington Health Zone, based around multidisciplinary teams, clear goals and less bureaucracy, and much greater access for patients. Would the Minister agree with me that this is exactly the kind of reform that we need to be enabling through the forthcoming 10-year plan?
Minister.
Thank you, Mr Speaker. I do agree with the honourable member, and I would be delighted to work with him on the government's commitment to deliver a neighbourhood health service which reinforces integrated working for the NHS, local government, social care and wider partners as the norm.
Mr. Back there.
Thank you, Mr Speaker. Knutsford desperately needs a modern medical centre. The local GPs and the community are united that the current provision no longer is fit for purpose, and with the growing population it cannot meet everybody's need. So in light of the government's announcement of £102 million to modernise GP surgeries to make it easier to see more patients, would the Minister meet with me to discuss a new modern medical centre for Knutsford?
Minister.
I thank the honourable member for recognising the significant investment announced today in GP services and buildings, and I'll be delighted to ensure that the relevant minister will meet with her.
Go Snell.
Well, sir.
Minister.
Thank you, Mr Speaker. Driving down waiting times is one of this government's top priorities, and my colleagues at NHS England continue to keep in regular contact with ICBs on improving those waiting times and delivering the ambitions in our elective reform plan. Since July, we've cut waiting lists by more than 219,000 across England and 6,000 in university hospitals in North Midlands, and delivered 3 million more appointments.
Go Snell.
Thank you, Mr Speaker, and I thank the Minister for her answer and recognise the Herculean effort the Department is making to reduce waiting times, particularly in Stoke-on-Trent. But one cancer patient who is having their treatment at the Royal Stoke Hospital in my constituency has shared her story with me. From the initial operation, it took 6 weeks for her to be told she may have cancerous cells in the lymph node. There was a delay in the CT scan, and then after the CT scan, she was told it was 10 weeks to meet an oncologist to discuss the results. So could the Minister say a bit more about how, whilst reducing access to the waiting times into the service, once someone's in a treatment plan, how is the Department making sure that treatment is given in a timely fashion?
Minister.
Well, I am sorry for the experience that his constituent has had, and he highlights a really important aspect of the patient journey through the system, and I want him and the House to be absolutely assured that we are looking at that entire patient journey, both into hospitals and between hospitals. We are determined to improve patient experience and the quality of their care and get back that patient satisfaction that was squandered by the last government.
Adam Jones.
Team, Mr Speaker.
Tuesday.
Thank you, Mr Speaker. Reducing hospital backlogs is a key priority for this government's plan for change, as the 18-week standard for elective care has not been met for almost a decade. Our elective reform plan sets out how we return to this standard by the end of this Parliament through a combination of investment and reform. Since July, the waiting list has reduced by over 219,000, and we have delivered an extra 3 million appointments, exceeding our manifesto pledge and doing it earlier than planned.
Yogi.
I'm grateful to the Secretary for his answer and for the progress made, but there is still more to do. My constituent in Newcastle Lyme has recently been recovering from brain surgery at the Royal Stoke University Hospital. However, she's faced multiple setbacks due to failures in duty of care, including scalding injuries and a severely mishandled admission process. She's now receiving the correct care but had to wait many months to be admitted to the correct ward and has been given limited time for rehabilitative treatment. So does the Secretary agree with me that to tackle backlogs, our hospitals must have the resources they need to provide the right care the first time round, and that patients are given the time and support to fully and effectively recover?
Mr Speaker, I'm grateful to my honourable friend for his question and horrified to hear about his constituents' experience. This is a government that will never brush problems under the carpet, that will never pretend that things are better than they are, and I know that for all the progress we've made in the last 10 months, there is still so much more to do. And when we publish our 10-year plan for health, we've got to make sure that quality and safety are at the heart of every patient interaction. He's right about the need for investment. That's why we're investing £26 billion in the NHS and social care, and why it's so disappointing that the parties opposite voted against it.
Vera Hobhouse.
On a recent visit to the Royal United Hospital in Bath's breast unit, specialists told me about a red flag system which could help speed up care. If someone has a red flag symptom, like a lump or bleeding nipple, the triage team could book them straight into the breast clinic rather than waiting to see a GP. Would the Secretary of State support an approach like that?
Can I thank the honourable member for an extremely constructive contribution? That is exactly why, at the heart of our plans for reform and modernisation, we're also placing such an emphasis on the digital and technological transformation. We have such rich data about our patients' experiences that we're not using effectively enough. If we use the information more effectively and efficiently, we can spot and identify risk much more proactively and make sure that people get timely access to urgent care and treatment when they need it.
Dr. Britton.
Thank you, Mr. Speaker, and I'm also grateful to the Secretary of State for the work he and his team have done to reduce NHS waiting times month on month for the last 6 months. However, the backlog that grew under the last Conservative government is still impacting my constituents, and I've listened to countless constituents who've told me about the upsetting impact of long waiting times for an ADHD diagnosis for children. This is having a detrimental knock-on impact on access to support, including to CAM services, shared care agreements and lack of support for adopted children. I welcome the news that the waiting lists have gone down, but can the Minister set out how his work will be targeted to bring down waiting lists for an ADHD diagnosis in my constituency to ensure consistency in diagnosis rates across trusts?
Thanks, so grateful to my honourable friend for her question, and I pay tribute to my right honourable friend, the Secretary of State for Education, who's leading work cross-government in this area. We have a task force specifically looking at the issues that she raises, and together we're looking to make sure that our education and our health services are better joined up to meet the needs of young people. I'm also working with my honourable friend, the member for Whitehaven and Workington, to look at how, drawing on his experience, how we can improve the health and care of care-experienced young people and young adults. So I hope we'll have lots of progress to report on these issues.
Lee Anderson.
Thank you, Mr. Speaker. Of course, one of the ways to reduce the backlogs is to reduce or put an end to health tourism in this country, where people come to this country, get the treatment and then nip back to where they come from. So does the Secretary of State think it's a good idea that people entering this country should provide health insurance or be refused entry?
Mr. Speaker, when any of us travel abroad, we expect to take out travel insurance and pay for our healthcare needs overseas, and that is the standard we expect for visitors to our country too. We've got lots more to do to improve on that front. Can I also say that I deplore the comments made by his party leader, who said he does not support a taxpayer-funded NHS for the British people. He might want that debate. The leader of the so-called opposition says she wants that debate. As far as Labour's concerned, we're clear about where we stand. This will always be, under Labour, a national health service, publicly funded and free at the point of use.
Question 15. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. This government is taking a hard-headed approach to cutting waiting times. We're investing an extra £26 billion in our NHS, and where the independent sector has spare capacity, we will pay to get NHS patients treated faster, free at the point of use. So far, our approach to investment and reform has cut waiting lists by over 200,000. Perhaps the honourable member will tell us how it's going in Scotland.
Logan.
Thank you, Mr. Speaker. The Secretary of State claimed this morning on BBC Radio 4 Today programme, and a most excellent programme it is, that the Labour Party are the only party that can be trusted with the National Health Service. So can he confirm that no aspect of the NHS whatsoever, whether ownership of the estate, provision of specialist services or any other form of privatisation, will be included in the much-promised trade deal between the UK and the United States? No more excuses, Secretary of State. Just give a direct answer to a direct question.
Mr. Speaker, I've said it before and I'll say it again. The NHS will be privatised over my dead body. This party founded the NHS as a publicly funded public service, free at the point of use. We do use the independent sector to cut waiting lists. And guess what? The SNP-led government in Scotland does the same thing. We've also made it clear that the NHS is not up for sale in any trade deal. It is clear, it is unequivocal. He can sling mud as much as he likes. What he can't do is run from the SNP's abysmal record on the NHS of 18 long, poor years.
Right, let us come to the topicals. Yuan Yang.
Question number 1, Mr. Speaker.
Stay.
Straight to the top. Thank you, Mr. Speaker. GPs are at the front door to our NHS. Today, I can announce that we are supporting over 1,000 surgeries across the country to modernise their buildings, backed by over £102 million, the biggest public investment in GP facilities for 5 years. Following years of neglect, this vital funding will create additional space to see more patients, boost productivity, improve patient care, and will enable 8 million more family doctor appointments each year.
Thank you, Mr. Speaker. I very much welcome today's announcement of refurbishing 1,000 GP surgeries across the country, because I've made it my own priority to meet with as many GPs as possible in my own constituency of Burley and Woodley. Our local GPs have been telling me that our health centres need more physical space in order to accommodate growing local needs, as well as to facilitate the expansion of healthcare into the community. So would the Secretary of State be willing to meet with me and my local GPs to discuss how we can better improve the physical space needed for care to be brought close to people's homes?
Thank you, Mr. Speaker. I'd be delighted to do so. Since we came into government, we made this announcement today. We put £889 million into general practice. We've agreed a contract with GPs, including reform for patient access and services. We are fixing the front door to the NHS. Of course, it will take time. We've recruited 1,500 more GPs by the end of March, but day by day, week by week, month by month and year by year, people should see improvements in their GP services thanks to Labour.
Shadow Minister Dr Caroline Johnson.
Thank you, Mr. Speaker. Mr. Speaker, taking medicines on time is important, especially for conditions such as diabetes and epilepsy. Dr Atchison, an A&E consultant who has time-critical medicines for his own Parkinson's disease, understands this well. He's been running a quality improvement programme to ensure time-critical medicines are given on time in A&E. Will the Secretary of State lend this project his support, and will he commit to reviewing how time-critical medicines are delivered on wards as well?
Mr. Speaker, I thank the Shadow Minister for her constructive question. I'd be delighted to hear more about this particular initiative. She's absolutely right about timely access to medicines, and I think through a combination of service reform but also modernisation of technology, we can assist clinicians and patients to help them manage their medication and make sure people get timely access to medicines.
Dr Caroline Johnson.
Thank you, Mr. Speaker, and I thank the Secretary of State for that answer. I'll be delighted to meet with him to discuss it further. Mr. Speaker, unfortunately, when Labour negotiates, Britain loses, and this government capitulated to union demands with nothing in return. It is therefore of no surprise to anyone that within months they're back in dispute with resident doctors, and that the BMA have announced a ballot for strike action. So what is the Secretary of State going to do to protect patients and taxpayers?
Mr. Speaker, I'll tell you what we're not going to do. We're not going to see £1.7 billion wasted on resident doctor strikes. We're not going to see 1.5 million cancelled operations and appointments. That's exactly what happened on their watch. Within 3 weeks, we ended the resident doctor strikes, and we've cut waiting lists by 200,000 as a result. As I've said to resident doctors, they will see their pay offer is fair, and that neither staff nor patients want to go back to the bad old days of strikes under the Tories. They had an unwilling and incalcitrant government under the Conservatives, unwilling to work with resident doctors. We want to work with them to deliver better care for patients.
Mr Richard Quidley.
Thank you, Mr. Speaker. I would like to pay tribute to my 17-year-old constituent, Arlo Lamley, who tragically died on April the 13th following a diagnosis of a grade 4 brain tumour. I knew Arlo. He was a fun and bright lad and will be sadly missed. Whilst Arlo's parents, Ellie and Alex, wish to put on record their thanks for the, in their words, incredible and compassionate care Arlo received at St Mary's Hospital on the Isle of Wight, they want to know what steps the Secretary of State is taking to improve NHS access to breakthrough treatments, ensuring that the commercial interests of pharmaceutical companies do not take precedence, so that children like Arlo are given the best possible chance of surviving longer from brain cancer.
Minister.
Thank you, Mr. Speaker, and I'd like to add my condolences and heartfelt condolences to Arlo's family. In September, we launched a new series of funding opportunities designed to help increase brain cancer research for both adults and children, and we're committed to furthering our investment and support for high-quality brain tumour research, ensuring funding is used in the most meaningful and impactful way. Honourable members will note that there is a debate due on Thursday on brain tumours, and I'll also be attending the APPG on brain tumours next week.
Helen Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr Speaker. When he gave his statement to the House just after Christmas, the Secretary of State acknowledged that cross-party consensus is essential to delivering meaningful social care reform, and Liberal Democrats support him in that endeavour. But we still don't have a date for those cross-party meetings. Will he give us one now?
Mr Speaker, dates for meetings with the Commission are now a matter for the Independent Commission.
Joyce McAllister.
Thank you, Mr Speaker. West Cumbria, like many parts of the UK, is a dental desert, and in some communities, urgent dental access centres have proven a real success at building up dental services. So will the Minister join with me in supporting my campaign to introduce an urgent dental access centre in West Cumbria?
I thank him. The government has, of course, launched the 700,000 urgent dental appointments. I think there's 57,500 allocated to his ICB. He will know, of course, that ICBs are responsible for commissioning primary care services based on the needs of the population. But I also know that he is a very strong campaigner for his constituents. I understand that his dialogue with his ICB on this matter has been positive and constructive, and I'm sure that he will continue to fly the flag.
Sir Jeremy Hunt.
The Chief Executive of the Royal College of Midwives said that the axing of the maternity safety ring-fence pot would, she said, be a wrecking ball to the efforts being made to improve maternity safety. Just a single or a small group of babies spared lifelong disability will more than pay for the cost of this many times over. I know the Secretary of State cares about this deeply, so will he reconsider?
Mr Speaker, the funding is still there, but as many people have urged me, including the right honourable gentleman, we are taking the decision to give more freedom and more flexibility to independent care boards and systems and providers to determine how they can best spend NHS resources on services to improve patient care, safety and outcomes. I think everyone will know that maternity safety is understandably a priority for this government. And of course, we expect and will hold the NHS to account to deliver on maternity safety standards.
Olivia Bailey.
Thank you, Mr Speaker. Residents in Thiel and across my constituency tell me time and time again how hard it is to get a GP appointment, causing distress and sometimes dangerous delays. Can the Secretary of State outline how his programme of reform and investment will end the 8 a.m. scramble for good and deliver more GP appointments for my constituents?
Minister.
I thank her. She will know that we've hired 1,500 more GPs. That's going to help with access. We've also renegotiated the contract so that there will be online booking systems in every practice in the country, and we've changed the contract to incentivise continuity of care in order to bring back the family doctor. So there's a suite of reforms coupled with investment. I hope that that will deliver for her constituents.
Bob Blackman.
Thank you, Speaker. One of the great frustrations for medical professionals and patients alike is those patients that have appointments but don't turn up. So what action is the Secretary of State going to take to make sure that actually people that miss appointments are penalised in the system, and so that patients can actually get the treatment they need when they need it?
Thank you, Mr Speaker. We're absolutely convinced that better use of digital tools will enable us to reduce significantly the number of missed appointments and also build in and factor in the likelihood of no-show so that we can reduce waste, eliminate inefficiency. I understand the case he's making for penalties. That's not a route we want to go down until we've made these improvements, and we'll judge how effective they've been then.
Jim Dixon.
Thank you, Mr Speaker. Far too many promises made by the last government that care would move out of hospitals and into the community have turned out to be hollow. I know from speaking to residents in Dartford that hospital and community services have struggled to keep pace with new housing developments in the constituency. In Dartford later this year, I'm pleased to say we're going to see an expansion of our state-of-the-art community diagnostic centre taking care closer to where people live in Dartford. Would the Minister agree with me that this is the start of Labour getting on with finally delivering this big shift? And will he visit Dartford with me to see the centre?
Order, Jim. Come on, I think he got the message in the first stage. If he didn't know it, I'm surprised. Come on, who's answering?
Mr Speaker, he is absolutely right, though, that this is exactly the sort of thing that we are seeing being rolled out across the country and committed to delivering care closer to where his residents live.
Blake Stevenson.
Residents in mid-Bedfordshire are concerned about the standards of maintenance at our two local hospitals. What action is the government taking to support our hospitals in Luton and Bedford catch up on maintenance backlogs?
Thanks to the investment the Chancellor committed to, we are investing in the sorry state of the NHS estate. I'm afraid that is an investment the honourable gentleman voted for, and his constituents will be fuming when they find out who was responsible.
Thank you, Mr. Speaker. Recently I heard from Chelsea, a constituent of mine, who raised concerns over her grandmother Anna's care. After a delayed discharge, she was released with the wrong equipment, which sadly resulted in her falling out of bed and sustaining a further injury. Ensuring patients are discharged in a safe and timely manner is key to continuing the department's significant progress in cutting waiting lists for treatment. So what steps is the Secretary of State taken to promote integrated working between services to support the discharge into the community of patients?
Thank you, Mr. Speaker. I'm extremely sorry to hear of that particular case. It's really important that we do support better and facilitate better discharge. That's why we're reforming the Better Care Fund, looking to integrate better health and social care services through our 10-year plan. And I'd be delighted to hear further from him about what we can do to improve in his area.
Thank you, Mr. Speaker. I have a constituent who has broken and rotting tooth, whose GP referred him to the local dental hospital, but he's been refused treatment as the dental hospital said the surgeon would only take a referral from a dentist, and something my constituent and many others in Somerset just don't have. So what does the Minister suggest he's to do to stop the pain?
Minister. Well, I thank her for that question. She will know that we've now got a commitment to 700,000 more urgent dental appointments. For those who don't have an NHS dentist, they can call 111 and they will be prioritised. We are very clear, every ICB has a target on the 700,000, and if they're not hitting that target, we will want to know why.
Olivia Blake.
It is disappointing to hear from many of my constituents about difficulties accessing diagnosis, medication and other therapeutic inputs and the impact on their lives and livelihoods as a result. Whether it's children or adults, waits of 2, 5, 7 years are becoming the norm. What steps are the government taking to make sure that individuals can use their and exercise their right to choose?
Minister.
I thank her, and I'd like to pay tribute to her for improving support for ADHD and recognising the valuable perspective that she brings through her own lived experience. This government inherited a broken NHS with too many people facing long waits for assessments. NHS England's ADHD task force is looking at how support for people with ADHD can be improved. I look forward to reading the report, and I had a very productive meeting with the director of that task force recently.
Given that the government is committed to 700,000 extra emergency dental appointments, but in the Midlands the UDA rate is just 83% and there's no additional funding for the ICBs, will the Minister give assurance to my Mid-Leicestershire constituents that they will fully deliver on this promise?
I will give him that assurance. We've been very clear that every ICB has a target. That was very transparently published, and we will be monitoring. I'm holding regular meetings with officials to check that every single ICB is on track to hit those targets, and if they're not on track to hit those targets, we will want to know why.
Marcus Campbell-Sabers.
Thank you, Mr. Speaker. Earlier this year, I met with the Cockermouth and Maryport Primary Care Network, who told me about the increasing challenge of supporting my constituents with their mental health. Has the Secretary of State considered relaxation of ours funding rules to allow mental health nurses to be employed wholly by a PCN and not need to be under the employment of the local mental health trust? This flexibility could help GP practices to intervene earlier and reduce referrals to secondary care quickly.
I thank him for that question. We have in fact relaxed the rules on ours so that a mental health worker can be employed in the PCN. He's absolutely right that that's an important part of stepping from hospital to community, but of course there's more that we can do on that, and we continue to do whatever we can to ensure that mental health and GP surgeries are actively integrating.
Robin Swan.
Getting it right first time is a clinician-led programme which leads on improvement and transformation. Can the Secretary of State give reassurance that on any restructuring of NHS England, that getting it right first time, that programme will not just be continued, but it will be expanded and still available to the devolved administrations?
Minister.
I'm absolutely willing to give him that commitment. I know that's something that he has worked on in his previous role in Northern Ireland. It is a programme that's delivering results. We want to see results. We want to take the best to the rest of the NHS and absolutely work together across the United Kingdom to make sure that all our residents across the United Kingdom benefit from the programme.
Gregor Poynton.
Thank you, Mr Speaker. Lung cancer causes more deaths in Scotland than anywhere else in the UK. In England, though, early detection programmes are underway. By 2028, every patient is likely to gain access to screening. In Scotland, though, doctors tell me this programme is a distant dream. Does my right honourable friend agree that SNP is failing Scottish patients, failing Scottish healthcare professionals, and this UK Labour government is getting on with the task of fighting this deadly cancer?
Minister.
I would agree with my honourable friend. We are making great strides in terms of developing our cancer plans. We will be launching a national cancer plan later this year, and the targeted lung cancer screening programme has been particularly effective. The SNP have had a record settlement for Holyrood, and we expect them to deliver. And if they can't, then I'm quite sure that Anna Sawa and Jackie Bailey would be willing to take over.
Thank you, Mr Speaker. Yesterday's report from the Health and Social Care Committee is explicit that we cannot build an NHS fit for the future without effectively reforming social care. Back in January, the Secretary of State promised cross-party talks as well as Baroness Casey's commission. He cannot outsource political leadership to Baroness Casey. Political will is the sticking point with reform of social care. Will he show that leadership? Bring the parties together to find the solutions to unblock this crisis.
Mr Speaker, since we came into government, we've already taken action on social care, the investment that we put in, the biggest expansion of carers allowance, the home adaptations through the Disabled Facilities Grant. Now the Commission is up and running, there will be cross-party engagement, but it is an independent Commission and for Baroness Casey to decide how to engage.
Catherine Atkins.
Last week, this Labour government announced the freezing of prescription charges, putting pounds back in the pockets of people in Derby. I visited pharmacies like the Little Over Pharmacy, which provides essential care and support for their communities. But the Conservatives underfunded pharmacies, and across England, over 750 closed between 2021 and 2024. What is the Minister doing to support community pharmacies so we don't lose these vital local services?
I thank her for that question. After years of neglect, this government has agreed with the sector a record uplift to £3.1 billion for 25-26 for this vitally important front door to our NHS. We're also supporting pharmacies to operate more efficiently, including enabling hub and spoke dispensing between all pharmacies later this year, and the legislation for that has been laid, I'm pleased to say. So what a contrast with the previous 14 years. Also very pleased to see that the NPA has withdrawn its view on taking collective action. So we're moving in the right direction, but still a lot more to do.
Alan Miller.
Thank you, Mr Speaker. Welcome today's announcement of the new money for GP surgeries, but in my constituency of Bicester and Woodstock, GPs tell me that they cannot get capital out of the ICB and that the Valuation Office consistently undervalues the cost of rents, making future GP building impossible. Will the Minister agree to meet with me and GPs from my constituency to understand this problem better?
Mr Speaker, thanks to the investment that we've announced, there will be the upgrade to those practices. I advise him to engage with his ICB. We're happy to receive representations if we can help. I would gently point out the investment is only possible thanks to the decisions made by the Chancellor, which he opposed.
Sonia Kumar.
Thank you, Mr Speaker. Ladies Walk NHS Health Centre in Sedgley is a vital hub for my constituents, providing essential services such as phlebotomy and diabetic foot care. However, due to the inaction of the Conservative Council, this much-needed community asset faces closure in 2026, leaving residents without access to critical care. Will my right honourable friend agree with me to discuss urgent steps to safeguard the future of the Ladies Walk Centre and ensure that Sedgley residents continue to receive the NHS services they rely on?
I thank her for that question, and of course pay tribute to the fact that she is in fact a qualified physiotherapist, so she's absolutely right to be talking about the importance of community care. I would be happy to meet with her to discuss the important issue that she raises.
Jim Shannon.
Speaker, what steps will be taken to support more community pharmacies that can offer a broad range of services to those in rural areas to ensure that those most isolated from busy towns still have access to these very important services? Thank you so much.
Well, thank you. And as I mentioned, we've got a record uplift to £3.1 billion. That's a 19% uplift of all the sectors across the NHS. It was actually pharmacy that got the best uplift from the 25-26 settlement. I'm very pleased to confirm. We've also maintained the Pharmacy Access Scheme that provides £19 million to support pharmacies in areas where there are fewer pharmacies, including in rural areas, as the Honourable Gentleman has mentioned.
John Trickett.
Well, on pharmacies, they play a key role in communities in rural areas like mine. But when the supply chain breaks down and the pharmacy isn't able to deliver the medicine, clearly it's deeply frustrating. Can the Minister tell us where we are now with the supply chain, and will he thank all of those heroic workers up and down the country doing their very best to deliver these medicines? And finally, will he thank particularly the 400 workers working for Superdrug in my constituency to try to make the supply chain work?
Minister.
Mr. Speaker, I'm pleased to congratulate and support the hard work of both the pharmacies at the front line and all the people that are involved in the department and elsewhere to make sure our supply chain is as resilient as possible. I know this is an issue that concerns many members of Parliament and many of our constituents. We are looking to do some sort of event in Parliament, Mr. Speaker, to bring the information more closely to all members, but they do a great deal of work. We know it's an important issue, and I will update the House on other measures we're looking to take forward to make sure that them and their constituents are better informed.
Final question, Vicky Slade.
Last month I began receiving concerning emails from the employees of the NHS Trust in my constituency of Mid Dorset and North Poole that their trust were looking to create a subsidiary company to move staff across into, and they're really worried about their rights for the future. And I know how important it is to you that people have good employment rights. What steps is the Minister taking to ensure fair consultation with staff before creating these subsidiaries and prevent the creation of two-tier employment practices in the NHS where they don't have continuity of service?
Mr. Speaker, while I understand the desirability of NHS Trust for such arrangements, this government is absolutely clear that staff must be in receipt of good NHS terms and conditions, must feel part of the NHS workforce, part of the NHS family, and I'd be happy to receive further representations from her.
Right, that completes questions. Let the front bench change over. We now come to the statement. Minister of State Dan Jarvis.
With permission, Mr. Speaker, I will make a statement on the series of national security-related arrests that took place on Saturday, the 3rd of May. Protecting our national security is the first duty of government, and it is a testament to our world-leading law enforcement and intelligence services that through their tireless commitment, so many plots against the UK have been thwarted. And I want to pay tribute to them again today for the work that they have done, not just this weekend, but in recent weeks and months on these important operations. The two operations that took place across multiple locations this weekend were significant and complex. They were some of the largest counter-state threats and counter-terrorism actions that we have seen in recent times. And I'm sure the whole House will want to join with me in thanking the police, the security services and other partner agencies across the country who showed their professionalism and expertise in carrying out these operations to keep our country safe. Now, honourable and right honourable members will understand that these are complex investigations. The police and the security services need the time and space to be able to pursue those investigations, and our first priority must be to protect the integrity of that work so we do not cut across those investigations and operations at a crucial time. However, these are serious matters and the House will rightly want to remain informed. I will therefore outline as much detail as I am able, and I hope that honourable and right honourable members will understand that there is a strict limit to what I can say at this stage, given investigations are now ongoing. Mr. Speaker, I would first like to outline the facts around the events on Saturday, the 3rd of May. Throughout that day, Terrorism Police undertook a series of arrests relating to 2 separate investigations. In total, 8 men were arrested by the Metropolitan Police's Counter-Terrorism Command. 5 men were arrested on suspicion of preparation of a terrorist act contrary to Section 5 of the Terrorism Act of 2006 as part of a proactive investigation in the areas of West London, Swindon, Rochdale, Stockport and Manchester. All 5 men are Iranian nationals. Whilst 4 of the individuals remain in police custody, the 5th individual has now been bailed with strict conditions. As part of the investigation, police officers carried out searches at a number of addresses in the Greater Manchester, London and Swindon areas. Investigations continue with searches and activity still underway at multiple addresses across the country. The investigation relates to a suspected plot to target specific premises. Police officers have been in contact with the affected site to make them aware and provide relevant security advice and support. However, the police have also been clear that for reasons of operational security and public safety, they are not, and I am not, able to provide further information on the target at this time. And I would urge members not to speculate on the site. In a separate police investigation, 2 men were arrested at 2 different addresses in northwest London, and 1 man was arrested at an address in West London. All 3 were arrested under the National Security Act of 2023. These 3 men are also Iranian nationals and remain in police custody. I can confirm to the House that these are the first Iranian nationals arrested under the National Security Act. The operations to execute these 8 arrests under both counter-terror and counter-state threat powers in different parts of the country in the space of 24 hours were intensive. They involved a range of different organisations, including different police forces, counter-terror police, the National Crime Agency, and our security and intelligence services. These operations were coordinated through the world-leading Counter-Terrorism Operations Centre, or CTOC, which brings together and coordinates the UK's agencies alongside the agencies of our Five Eyes partners to detect and tackle national security threats. I welcome the work of the previous government to establish CTOC in 2021, which this government has continued to support and invest in since taking office. The significant point about both counter-terrorism and counter-state threats powers is that they allow the police to intervene early to prevent and disrupt threats, not just respond after events have taken place. This is crucial for public safety, but it also makes the investigations more complex, and that is why the police need the time and space to pursue them now. So we will not be providing a running commentary on the work that they are doing. But what now follows is an incredibly complex set of investigations involving hundreds more officers carrying out forensic searches, collecting vital evidence across different sites across the country, and securing witness statements backed up by the continued efforts of our security and intelligence agencies. This is careful, painstaking work. Mr. Speaker, at this stage in the operations and investigations, it would not be appropriate for me to speculate on or comment further on the details of these 2 cases and the motivations behind any of the threats that were posed. But the House will be aware that these operations come against a backdrop of complex, interconnected threats to the UK, where state threats and counter-terrorism, as well as serious and organised crime, are intertwined together. For 20 years, the greatest focus of our national security work was on terrorism, primarily from Islamist terrorism, with additional threats from Northern Ireland-related terrorism and other areas, and those threats have not gone away. 15 terrorist attacks have taken place since 2017, and there have been 43 late-stage disruptions of terrorism plots. But alongside that, we have seen a serious, growing and complex challenge from state threats. Last year, Sir Ken McCallum, the Director General of MI5, said that MI5 state threat investigations had increased by 48% in the previous 12 months. He added that since January 2022, the police and MI5 had responded to 20 Iran-backed plots presenting potentially lethal threats. In March, I told Parliament that the UK is facing a growing and evolving threat from malign activity carried out by a number of states. My statement in March outlined the government's response to the unacceptable threat that we face from the Iranian state and the steps we are taking to ensure that our intelligence and law enforcement agencies have the tools they need to disrupt and degrade Iran's malign activity on UK soil, and we have delivered on the commitments made. I announced that the whole of the Iranian state, including the IRGC and MOIS, would be placed on the enhanced tier of the Foreign Influence Registration Scheme, and I laid the regulations to make this happen in the House on the 1st of April and committed to bring the scheme into force on the 1st of July. I trust that all members will vote in favour when those regulations are debated shortly. Let me be clear. Anyone in the UK who works for the Iranian state must declare it, or they will be committing a serious criminal offence. We will also go after the criminal networks and enablers that Iran used to carry out its work, and the government sanctioned the Foxtrot network last month, a network involved in violence against Jewish and Israeli targets in Europe on behalf of the Iranian regime. Training and guidance on state threats activity is now being offered by counter-terrorism policing to all 45 territorial polices across the UK, and the independent reviewer of terrorism and state threats legislation, Jonathan Hall KC, was asked by the Home Secretary to review the parts of our counter-terrorism framework which could be applied to modern-day state threats such as those from Iran. The Home Secretary specifically asked the reviewer to look at a state threats prescription tool so we are not held back in limitations in applying counter-terrorism legislation to state threats. Jonathan Hall has now completed his review and will publish it shortly, and the government will not hesitate to take action in response to Mr. Hall's advice. As we continue to support the police and the security services in their investigations, I can also tell the House that the Home Secretary has instigated a series of security assessments which are being done or being refreshed in the light of the cases this weekend and the further information surrounding them. This will ensure that the government can respond robustly and comprehensively to any wider national security issues raised by these cases. Mr. Speaker, working alongside our international allies in countering state threats is central to our success. The Foreign Office are engaging with our closest allies to outline the disruptive action that has taken place and will be considering potential future response options as the investigation progresses. The Home Secretary remains in close contact with my Right Honourable friend, the Foreign Secretary, who I know is committed to doing everything that is necessary to protect the country from these threats and to bring to bear all the diplomatic tools at our disposal. Mr. Speaker, the Home Secretary and Ministers will provide an update on the national security position when we are able to do so, both following these operations and investigations and the wider security assessments that are underway. The Government will not hesitate to act in a robust manner to respond to these plots at the appropriate time, but first we must allow the investigations to continue. Our police, security and intelligence agencies are the best in the world and stand ready at all times to take action to keep our country safe. I am sure that they will have the support of the whole House as they continue this vital work. I commend this statement to the House.
Shadow Minister Matt Vickers.
Thank you, Mr Speaker. I'd like to thank the Minister for providing advance sight of the statement on this critical issue. People will have read the deeply concerning report suggesting that an attack may have been just hours away. This will understandably be worrying to people across the country. This statement reminds us of the tragic incidents that have plagued our country in the past. This month marks 12 years since the death of Lee Rigby on our streets. It also marks 8 years since the horrific Manchester Arena bombing. And later this year will mark the 20th anniversary of the 7/7 attacks, which brought a level of destruction to London that many of us never thought we would see in our lifetimes. These acts of terror, along with other cowardly acts, cause untold hurt to victims and their families. As we discuss the arrests over the past weekend, we must remember the importance of keeping the British public safe from those who seek to terrorise us. I therefore pay tribute to the hard-working members of the police and the intelligence services for their bravery in disrupting terrorist activities. In October, the head of MI5 said that together the police and MI5 had disrupted 43 late-stage attack plots since the Manchester bombing. We must remember that each of these cases is not merely a statistic, but represents someone's life and someone's future. I commend the Minister for recognising the work of the previous government and for acknowledging the measures that we used effectively in this incident. In turn, I know that we'll support measures that enact the National Security Act and give the government the powers needed to act against malign influences on our country. Turning to the incident at hand, I'd be grateful if the Minister could clarify certain points. While I'm thankful for today's statement, I hope the government will, moving forwards, be as transparent as possible about the details to avoid the vacuum of information we've previously discussed in this place. Even though I appreciate that the government does not want to provide a running commentary, I, and I'm sure many other members, would be grateful if it could be as open as possible, given the seriousness of the arrests. As the Minister has outlined, there were 2 separate arrests of Iranian nationals in relation to terror offences. These raised serious questions about how their networks were formed and what their intentions were. Can the Minister provide any further information about the suspects? For example, while we know they were Iranian nationals, what is their immigration status? Was the state aware that these individuals were in the UK? And was there any prior indication of the risk they might pose? In addition, on the broader issue of Iran, while I understand the Minister may not be able to comment on proscription directly, the Home Secretary did address this while in opposition. In July 2023, she told the Royal United Services Institute, instead of trying and failing to use counter-terror legislation to prescribe organisations like Wagner and IRGC, we'll introduce a bespoke prescribing mechanism to address state-sponsored threats. The Home Secretary also said at the dispatch box in April 24 that it wanted appropriately targeted prescription-style restrictions on the operations of state-linked organisations such as IRGC. However, it was only in March this year that the Security Minister announced the review by Jonathan Hall. Does the Minister share my concerns that these mixed signals and the delay suggest a lack of prioritisation from the government? Ultimately, we must all work together to ensure that the UK adopts the strongest possible stance on national security. Cross-party cooperation is essential. I therefore urge the government to take every possible step to prevent these cowardly acts of terror.
Thank you, Mr Speaker. Can I thank the Shadow Minister for, I think, the very sensible, reasonable and constructive tone of his response. And can I also say to him, he's absolutely right to draw the House's attention to the tragic death of Lee Rigby, the tragic bombing in Manchester, and, of course, the 20th anniversary of the 7/7 bombings that we will be commemorating in a couple of months' time. Let me again join with him in paying tribute to all of those who work tirelessly to keep our country safe. It is one of the greatest privileges of this particular role that we have the opportunity to serve in government, as members opposite will have done also, and work very closely alongside those incredibly committed members of the police and the intelligence services, and I think we owe them a debt of gratitude. I'm also grateful for the opportunity, because he raised it again, to offer our thanks for the work that was done by the previous government, both in terms of the introduction of the National Security Act, which has proved to be an incredibly valuable tool, but also, and I referenced it in my earlier statement, the creation of CTOC, which is delivering very significant operational value. And I can absolutely give an assurance that this government will continue to invest in that institution, as the previous government did as well. I thought he made an important point about transparency, and I can absolutely give him the reassurances that he seeks. He will understand, and the House will understand, that we are just a couple of days on from these arrests taking place on Saturday. The Home Secretary will provide a further update as soon as we are operationally able to do so. And I give him a commitment that we will be as transparent as we possibly can, whilst, of course, ensuring that we do not cut across live counter-terrorism operations. He mentioned prescription, and I understand why he asked the question. I know that he will acknowledge, or at least I hope he will, that on the 4th of March, I announced a very strong suite of measures designed to most effectively address the nature of the threat that we face from Iran. Contained within those measures announced on the 3rd of March was a request from the Home Secretary for Jonathan Hall, who I know is held in very high regard because of the experience, the credibility that he has in this area, to look very carefully at the legislative framework that might enable us to more effectively prescribe state-based entities. I can confirm that Mr Hall has completed his report. The Home Secretary and I are considering it very carefully. It will be published shortly, and I give him an assurance that we won't hesitate to act where there is a requirement to bring forward further measures.
Burger.
Minister will be aware that a number of Iranian citizens in this country still have relatives in Iran, and it's not beyond the wit of the Iranian government to use that pressure on them. So in making the requirement to report to our government for citizens of Iran in this country, if they are in any way connected with the Iranian government, how has he taken measures to protect them from exposing their family to the pressure that the Iranian government may put on them?
Thank you, Mr Speaker. I think that the Honourable Member raises a very important point. I can give him the assurances that we seek. The government has been very carefully considering the matter of transnational repression, and we will have more to say about it in the near future. But I can give him an absolute assurance that we have been thinking carefully about these matters. We take them incredibly seriously, and the Home Secretary and I will have more to say in the near future.
Liberal Democrat spokesperson Lisa Smart.
Thank you very much, Mr Speaker, and I want to thank the Minister for advance sight of his statement and for updating the House this afternoon. I also want to add my thanks to the security services and the police for all their work to keep us safe. Over recent years, this House has been called into the Chamber to discuss plots to commit acts of terror on Britain's streets at the hands of the Iranian regime. And yet, consecutive governments are yet to prescribe the Iranian Revolutionary Guard Corps as a terrorist organisation. In opposition, the now Foreign Secretary said himself that the IRGC is behaving like a terrorist organisation and must now be prescribed as such. Earlier this year, I asked the Minister precisely this question. Does the Minister not agree that now is surely the time? In some of his earlier remarks, the Minister mentioned the review that's concluded, and if now isn't the time for prescription, when should the House expect a further update? Further, the Liberal Democrats have welcomed previous sanctions against those linked to the Iranian regime. However, I must urge the government to go a step further and look closely at whether these individuals and others with links to the regime have assets here in the UK. Will the Minister commit to carrying out an audit so that we know where those assets are, enabling the government to freeze them as appropriate? And the Minister is right to reference the long-standing pattern of targeting people of the Jewish faith and of Israeli nationality by the Iranian intelligence service. Could the Minister update the House on any conversations he has had with the UK Jewish community leadership, and specifically the CST, about threats here in the UK?
Thank you, Mr. Speaker. Can I thank the Honourable Lady for, as is always the case, the very sensible and reasonable way in which she's phrased her questions. And let me say to her, I'm always available to discuss these matters in more detail should she wish to do so. She asked about prescription, and I hope that she will acknowledge the response I gave to the Shadow Minister just a few moments ago. We take these matters incredibly seriously. The Home Secretary and I looked at these matters very closely in opposition, and that's precisely why the Home Secretary commissioned Jonathan Hall, and he's the right person to look very carefully at our legislative framework and make recommendations about whether, frankly, we can toughen and strengthen the laws that we have in this particular area. Mr. Hall has now concluded his report. We are looking very closely at it. It will be published shortly, and as I said to the Shadow Minister, we will not hesitate to bring forward further measures as they are required. She made, I thought, an important and helpful point about sanctions and assets. I know that that is a question that will have been heard by Foreign Office Minister, with whom we work incredibly carefully. We work hard to ensure that our response is always as joined up across government as it possibly can be, and the Home Secretary works very closely with the Foreign Secretary, and I work very closely with the Minister on these matters, but we will consider whether there are further measures that need to be taken. Her final point was a very important one about the Jewish community, and I give her and the whole House an absolute commitment that we will work tirelessly to ensure the safety of the Jewish community in our country. The Home Secretary and I and other ministers are in very regular contact with members of that community, including the CST that she referenced, who do an excellent job. I will be meeting them in the very near future, but she can be absolutely reassured that we will work very closely with them to ensure that they not only get the protection that they need and deserve, but the assurances that they will rightly want as well.
Paul Wall.
I'd like to pay tribute to the bravery and the professionalism of the counter-terrorist specialist firearms officers who took part in the arrest of an Iranian national in Rochdale over the weekend. It was indeed a reminder of the constant threat that we face, but also of the intelligence and police services' daily work to keep us all safe. But does the Minister agree with me that in this week of the 80th anniversary of VE Day, it's a reminder too that Britain is at war with a modern enemy, the fascism of Islamist extremism and state-sponsored terrorism? The message should go out loud and clear that my town, our country and this House will never surrender to such terrorism or to its ideology.
Well, the Honourable Member, I think, makes a very powerful and important point, and he's, of course, absolutely right. This government will never drop its guard to the threats that we face, whether that is counter-terrorism, whether that is the specific threat around Islamist extremism, whether that is around the state threats that we undoubtedly face. This government takes these matters incredibly seriously, and we will work to ensure that all of our security services and the police forces have the resources and the tools that they need to address the threats that we face.
Chair of the Select Committee, Dame Karen Bradley.
Thank you, Mr. Speaker. Can I thank the Minister for his statement? No one in this House should be in any doubt about the threat that Iran poses to us and our national security. How confident is he that the designation in the enhanced tier of the Foreign Influence Registration Scheme will be effective? Is he looking to go further?
Well, I'm grateful to the Right Honourable Lady for the work that she does as Chair of the Select Committee. I do believe that FERS is a very important measure falling out of the National Security Act. It is a measure that we inherited from the previous government. I think it is the right approach, and I think it will deliver significant operational benefit. But we also have to look at these matters in the round, so it doesn't sit on its own in isolation, and it has to be accompanied by a range of other measures, not least the measures that I announced on the 4th of March. But the government will remain flexible and agile, and if we think that there is a need for further action, then we will not hesitate to take it.
Alex So.
Thank you.
Mr. Speaker. My committee, the Joint Committee on Human Rights, is currently undertaking an inquiry on transnational repression. We have reams of evidence of Iran oppressing, of taking action against people of Iranian heritage here in the UK. I heard what the Minister said about prescription. I've asked for prescription of the RGC many times, who are certainly one of the bodies in Iran who are responsible for transnational repression. But could he just outline what will happen after the publication of John Hall's review and what the timetable will be, as we are keen to see swift action in this area?
Thank you, Mr. Speaker. Well, let me say to the honourable member that I'm looking forward, if that's the right way to describe it, to giving evidence to his committee in the near future. I can confirm, as I said to the honourable member previously, that this government has done a lot of work looking at the serious but complicated issue of transnational repression. The government will have more to say about this in the near future, and as I say, I look forward to providing more evidence to his committee, but I give him an assurance that we take these matters incredibly seriously. We have progressed at pace the work that we inherited from the previous government. These are not simple matters. These are matters that require a whole system approach. These are matters that we are working carefully across government through the Defending Democracy Task Force. But I give an assurance the Home Secretary and I will have more to say in the near future.
Farrell of the House, Sir Edward Lee.
Do we know whether these men entered the country illegally or legally? Obviously, people who enter this country legally are subject to extraordinarily sophisticated surveillance at our airports and ports. Yeah. But people who enter illegally, there is no surveillance at all. It's completely madness that thousands are entering our country with no checks at all. Isn't this a good opportunity to seek a derogation from the Court of Human Rights in Strasbourg and say, because of our national security, we should have the right to detain these people, arrest them and rapidly deport them? Yeah.
Well, I'm grateful to him for the very long-standing experience that he brings to this House. So he will understand, for the reasons that I've already outlined, that there are very strict limitations on what ministers can say at this point, because it would be unforgivable, frankly, to cut across a live counter-terrorism investigation. The police have set out the Iranian nationality of those arrested, and at this particular moment they need the time to pursue various lines of inquiry and investigation. As I hope that he and other honourable members will understand, as a consequence of that, it would be wrong for ministers to provide a running commentary on individuals' details at this stage, because, as members would expect, a wide range of security assessments are underway. The Home Secretary will set out further details at an appropriate moment in due course.
John Pierce.
Thank you, Mr. Speaker. I'd like to thank the Minister for his statement and also join him in thanking the incredible work and dedication of our security services and our police. This is a sobering reminder of the threat posed by the Iranian regime here in the UK and reinforces the need to proscribe Iran's terror army, the IRGC, here in the UK. We continue to hear disturbing reports of charities in the UK being used as vehicles for funding and organisation of terrorism. Will the Minister set out what steps are being taken to stop this organisation, and will he meet with me to discuss these concerns further?
Well, I'm grateful to him for the work that he does in this particular area, and he's absolutely right to make the point, as he does, about the grave threat. I hope that he will have seen the suite of measures that the government brought forward on the 4th of March. These were new measures that will make a very significant difference and will give us additional resources and capabilities in order to address the threat. I can give him an assurance that we take these matters incredibly seriously. As I mentioned, that there are a series of security assessments that are currently underway. The Home Secretary will report back to the House in due course on those. But of course, I'd be very happy to meet him to discuss these matters further.
Can I thank the Minister for what he said about the work of the previous government and join him in commending the work of our security services and police in keeping us safe. Now, recent events are a reminder of the destabilising role that Iran plays. 20 Iran-backed plots foiled in the UK in just the past few years. This state sponsor of terrorism cannot be allowed to have nuclear weapons. So on that topic, could I urge the government to push our European allies to jointly trigger snapback sanctions this year as part of a comprehensive strategy to put maximum pressure on the Iranian regime?
Can I thank the right honourable gentleman for his question and for the work that he did as Prime Minister. He knows better than most about the extraordinary capabilities that those men and women who serve in our intelligence and police forces have and the commitment that they make to our country. I think he made important points. He's completely right about the number of state-sponsored plots. That is totally unacceptable, and this government, as was the case with the previous government, are absolutely clear that we will do everything that we can to stand against them. He made an important point, I think, about the importance of working closely with our colleagues and partners in Europe and internationally. He's right. That is the approach that we will adopt, and I know that the colleagues in the Foreign Office are thinking very carefully about what more we can do in that area.
McKee. Thank you very much, Mr. Speaker. Can I thank the Minister for his statement and join him in paying tribute to the security services who keep us all safe. Now, as the Minister will know, the UK is under constant cyber attack from foreign states, including Iran. So can I ask the Minister to update the House on what work the Home Office is doing to protect the UK from ransomware attacks?
Well, I'm very grateful to him because he raises a very important point about cyber attacks, which we face along with countries right around the world. I hope that he will know that the Home Office has recently concluded a consultation on new measures specifically with regard to ransomware. These are world-leading measures that we believe will make a material difference to the nature of the threat that we face. Because essentially what we want to do is smash the business models of those cyber criminals, many of whom operate out of Russia, targeting UK businesses. These measures would be good for our national security, but also good for our economic prosperity. And I can give him an assurance that we are progressing them at pace.
Thank you, Mr. Speaker. I was alarmed to hear that one of these incidents took place in my constituency of Cheadle. It's chilling to think that a regime with such a shocking record of international aggression could have connections into our neighbourhoods. It just so happens I was meeting with the Jewish community in Cheadle this weekend to talk through the issues and concerns that they have. And at this meeting, I heard about how fearful they are of the threat of violence and terrorism from the Iranian regime. So therefore, can I ask the Minister to commit to providing a timeline and producing that report into the IRGC, and also commit into a timeline of when we are finally going to prescribe that organisation?
Well, thank you, Mr. Speaker. Can I thank him for the points that he makes? He's right about the chilling effect of these arrests. And it also underlines the nature of the threat not being specific to any one part of the country. He pressed me on the point that I'd made earlier with regard to prescription. Jonathan Hall, who, as I have said previously from the dispatch box, is someone of great credibility and authority, was asked by the Home Secretary to look carefully at our legislative framework in order to assess whether there are stronger powers that we need in order to be able to prescribe state-backed threats. Mr Hall has worked at pace and has now submitted his report to the Home Secretary and I. The report itself will be published shortly, and as I've said previously, the government will respond in due course, and I know that the Home Secretary will update the House at the earliest available moment.
Thank you, Mr. Speaker. The Security Minister will know that whenever there are reports of hostile acts by Iranian nationals in this country, the Jewish community in Britain have reason to be fearful. So can he update the House on the steps the government is taking to guarantee the safety of Jewish people throughout the UK?
Well, I'm grateful to him for the point that he has made, and I give him a categorical assurance that this government, as was the case with the previous government, will work incredibly closely with the Jewish community to provide them the assurances that they rightly want and deserve. It's completely unacceptable that any sector of our community could be threatened, whether that's by terrorism or by a state-based threat. Home Secretary and I and other ministers are in regular contact with the CST and a range of other organisations from the Jewish community, and we will work tirelessly to ensure that not only are they safe, but that they feel safe.
Sir Julian.
In the fullness of time, it will undoubtedly be revealed what the targets of these terrorist plots were going to be. If it turns out that one of them, again, was the broadcaster Iran International that had to relocate to Washington temporarily in 2023, will the Minister undertake to speak with his Foreign Office colleagues about the importance of impressing on the Trump administration that these repressive regimes fear free broadcasting agencies, and that's why the Trump administration should not be closing down Radio Free Europe, Radio Liberty, or indeed Voice of America itself?
Well, the Right Honourable Gentleman, as he always does, makes a very sage point, and he's absolutely right. There is an incredibly important relationship that the UK has with the United States. That is a relationship that we invest significantly in, and we think that that is not only in our national interest, but the national interest of the United States and other Five Eyes partners. I can give him an assurance that the question that he has just raised will be heard by colleagues, and I see the Minister nodding in the Foreign Office, but I'm keen to work closely with him and draw upon his experience in this area, and I agree with the point and the thrust of the direction of the points that he's made.
Chris Vance.
Thank you, Mr. Speaker, and I thank the Minister for coming here with this statement today. And can I also put on my record, and I'm sure the thanks also of the people of Harlow to the police and security services for the work they do, keeping us all safe. In his statement, the Minister made reference to working with allies, and I wonder whether he agrees with me that the conversation he has with our allies, both in Europe and in America, are key to tackling this problem proactively and ensuring that lives are saved.
Well, firstly, can I thank him for the point he made about our police forces, who do a very difficult job, but I think do it incredibly well. And it was deeply impressive to see their work over the course of the weekend. I think he makes an important point about international cooperation. Home Secretary, myself, other ministers, and right across the government completely understand the importance of investing in these relationships with our international allies. These are matters that we are not going to solve unilaterally on our own. We need to cooperate, collaborate with a range of international partners, both in Europe, in North America and further afield. And I can give him an assurance that that will be the approach of this government.
Thank you, Mr. Speaker, and I too pay tribute to the brilliance of our security forces. The Minister has paid tribute to the quality of advice from Jonathan Hall, KC, the independent reviewer of terrorism, and said that he will indeed listen to that advice. Well, that same Jonathan Hall, KC, last autumn advised that in serious incidences involving terror and these sorts of incidents, it would be better to put out more information sooner in order to prevent misinformation. And in order to prevent misinformation, surely the Minister should tell us and the British people who want to know, how long have these Iranian nationals been in this country and what is their immigration status?
Well, let me say to the Honourable Member that that's precisely why I made the point to the Shadow Minister about the importance of transparency. It's precisely why the government have proactively brought forward a statement to the House today in order to give members the opportunity to ask questions. And it's precisely why earlier on I gave a commitment that the Home Secretary will come and update the House when we are operationally able to do so. I know that the Honourable Member understands the importance of not cutting across a live police terrorism operation. I hope he will acknowledge that we take these matters incredibly seriously, that we brought forward a range of measures in March that goes a long way towards addressing the nature of the threat that we face. I hope he acknowledges the serious nature with which we always take these matters. But I say to him, I'm very happy to discuss these matters with him outside of this chamber, should he wish to do so.
Jacob Collier.
Thank you, Madam Deputy Speaker. And can I also pay tribute to our security and intelligence services in foiling what appears to be a highly coordinated plot. And the involvement of Iranian nationals points to a potential state-backed threat. So can the Minister assure me and my constituents that our intelligence and legal frameworks are keeping pace with the growing sophistication of hostile activity on British soil?
Well, I'm grateful to him. I can give him the assurance that our intelligence and legal frameworks have the necessary resource in order to ensure that we are best prepared to face the nature of the threat that undoubtedly we do face. But I can also say to him, the Home Secretary, Prime Minister and ministers across government will not hesitate to act should there be a requirement to bring forward further measures. That is precisely why the Home Secretary asked Mr Hall to look at the legislative framework. That is precisely why we are carefully considering his recommendations. But absolutely, I give an assurance that should there be a need to bring forward further powers, then we will not hesitate to do so.
David Reid.
Thank you, Madam Deputy Speaker. It's clear that the issues that we're seeing from Iran and its proxies are shared across many European countries as well. And the Minister raised the recent government sanctions on the Foxtrot network. However, the EU has just rejected the PM's bid to access the bloc's crime and migration database. Does the Minister see this as an issue and something that will stop us thwarting future threats against Iran and its proxies?
Let me respond to him in this way. As I've said previously, whilst there are certain measures that we could put in place in this country, and of course we will, it is imperative that we cooperate closely with our allies. And the nature of the relationship that we have with our allies in Europe is fundamentally important in this regard. I can give him an assurance that Foreign Office ministers, Foreign Secretary, the Minister, will be looking very closely at what's happened over previous days, talking to our allies and taking every opportunity to ensure that we organise collectively to ensure that those states who think that they can behave in an aggressive way towards this and other countries understand that there will be very severe consequences for their actions.
Dr. Andrew Morrison.
Thank you, Madam Deputy Speaker. Does the Minister agree with me that part of the problem of the Joint Comprehensive Plan of Action that the US withdrew from in 2018 was that it wasn't comprehensive enough in that it completely ignored the actions of Iran through proxy groups and terror cells? When he and his colleagues are discussing with the US administration the way forward, particularly in relation to the Witkoff talks, will he ensure that terrorism is covered as part of any agreement hatched?
Minister.
Thank you. So I think that's an important point the Right Honourable Gentleman has made. It is one that the Minister and I will consider further, but I can give him an assurance about our understanding and the priority that we attach to the international dynamic to all of this. He will understand, as a former minister, and he's been around a long time, that international relations requires us to work as collaboratively as we possibly can with our partners. We are investing heavily in ensuring that the special relationship that we have continues to deliver for our country and for other Five Eyes partners as well. The points that he has made are well made. We have heard them, we will consider them further, but I assure him we take these matters very seriously and we will work across government to address the issues that he raises.
Gregory Campbell.
Thank you, Madam Deputy Speaker, and I join with the Minister in paying tribute to our security services in their endeavours to keep us all safe. Would the Minister agree with me that the issue of how these suspects get into the United Kingdom in the first place is a crucial issue, and one that has he addressed with the Irish Republic's government regarding people who don't come in here directly but come in under the radar via Dublin and then into Northern Ireland and into mainland GB?
Yeah. Thank you, Madam Deputy Speaker. The Prime Minister has said that border security is national security. So the Honourable Member, I think, makes important points. That is precisely why I confirmed earlier on that as a consequence of recent events, the Home Secretary is looking very carefully, along with other Home Office ministers, at a number of areas. And at the earliest available opportunity, she will come back to this House and provide an update.
Whittingdale.
5 weeks ago, I visited Iran International at their location in London. They told me that their journalists face daily threats from Iran, as do those who work for the BBC Persian service. Given it's just 3 days after World Press Freedom Day, will the Minister reiterate this government's absolute determination to defend media freedom at home as well as abroad, and will he consider accepting the invitation to visit Iran International to reinforce that message?
Well, I'm very grateful to the Right Honourable Gentleman, who has been a very long-standing champion of both journalism and journalists, and I think he makes some very important points. I know that the Minister on the front bench from the Foreign Office has recently met with BBC Persia journalist colleagues, and between us we'll look very carefully at the invite that the Right Honourable Gentleman has extended. But let me be crystal clear that the threats that we have seen in recent time to Iran International are completely unacceptable. And this government, like the previous government, will do everything to ensure that free speech in this country is not materially affected by those out with the country who would wish to silence others. So we take these matters incredibly seriously. In response to a question earlier on, I said that the government will have more to say about transnational repression in due course, and that very much includes matters such as the ones that the Right Honourable Gentleman has raised.
Dame Harriet Baldwin.
Thank you, Madam Deputy Speaker, and I'm going to try again because I appreciate that the Security Minister has to be very careful about the specific aspects of this case, but I do think the House needs to know and the country needs to know whether the Iranian nationals in this case came into the UK illegally or under a legal migration route.
She's a very experienced member of this House, so I hope she can understand why, as the Security Minister, it would be wrong of me to cut across a live police terrorism investigation. Ministers should not be getting in front of or in the way of ongoing proceedings. And I hope that she will acknowledge the point I made earlier on about the complexity of the ongoing investigations. There are still properties around the country that are being searched by police officers. That is precisely why I've come here today to give a statement and update the House with the information that it is appropriate to update. But I've also given a very clear commitment that at the earliest available opportunity, the Home Secretary will come back to this place and give more details at a moment where it is operationally appropriate to do so.
Me. Oh, sorry, Madam Speaker. Yes, hello there. The Minister says in his statement that these were some of the largest, quote, largest counter-state threats and counter-terrorism actions we have seen in recent times. But if that's the case, I just wondered why the Iranian ambassador has not been summoned to the Foreign Office, and he mentioned liaising with the Foreign Secretary earlier. And on the issue of immigration status, that is not a police or counter-terrorism operational matter. It is a visa issue. So were any of these Iranian nationals dual nationals? Were they here on work visa or student visas? And were those visas issued at post or somewhere else around the world through another embassy or consulate? Previously, we've had incidents in this country where there have been vacuums of information and when the government have not been prepared to fill that vacuum with truth and facts. Others who want to stir up trouble in our nation have filled it instead.
I'm always grateful to him for the experience that he brings to these very important matters, and he's certainly right. This was a very significant operation that required a considerable amount of coordination across the weekend, and as I've explained, it is ongoing. It's very important that I don't in any way prejudice those inquiries, but I understand why he's made the point in the way that he has. I can say to him that there's been very close contact between the Home Secretary and the Foreign Secretary about these matters, And I can also say to him that the Minister from the Foreign Office, currently sat on the front bench, will be meeting with the Iranian ambassador to discuss these matters.
Jim Allister.
If, as the Prime Minister says, border security is national security, how can there be national security if there are no border checks on illegal immigrants at the international frontier between the United Kingdom and the Republic of Ireland? How then do we get security if we fail and refuse to carry out those fundamental checks?
Well, that's precisely why I referenced the Prime Minister's comments about the importance of border security and border security being national security, and precisely why I said that the Home Secretary and the Immigration Minister are looking very carefully at what happened over the weekend, but at other incidences as well. We won't hesitate to act where there is a requirement to do so, and as I've said, the Home Secretary will update the House on these matters further.
Lincoln John.
Thank you, Madam Deputy Speaker, and I thank the Minister for coming here with this statement today. I don't want to probe the out-of-bounds box that the Minister has quite rightly placed around the live investigation, but I therefore have chosen the words of this question very carefully. Does he know the immigration status of the Iranian nationals who were arrested?
I am grateful to him, and I pay tribute to his service in our armed forces before coming to this House. I hope, in part because of that background, he will understand that the one thing that I am not going to do is make things more difficult for those who serve in and out of uniform doing a very difficult job. I can say to him that the Home Secretary and I know what we need to know, but we are not going to get into a running commentary. But I've made a very clear commitment that the Home Secretary will come back at the earliest available opportunity and respond to the questions that honourable members wish to put to her. But what we are not going to do is cut across a live police operation. Honourable members opposite and around the House would never rightly forgive us for doing so. We're not going to do it, but we are committed to providing as much information as we possibly can at a point where it does not compromise ongoing operations.
Final question from this statement, Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank the Minister very much for his wise words, his strong words, his confident words, the words that I think every one of us in this House wishes to have in relation to the investigation. I have, in all my time in this chamber, some 14 coming 15 years, been a supporter of the Iranian diaspora, those who live in the United Kingdom and who fled Iran because of the threats that were made upon them in their lives. Some of them got out by the skin of their teeth. They have genuine fears, they have concerns about what happens, and those concerns have been expressed by some of those who've been Iranian diaspora who've been under some attack in France and Paris as one example, but also in Sweden. During the last election, that Iranian diaspora very kindly offered support to me and my election campaign, and I took advantage of that, as others did as well. What concerns me is those in Northern Ireland who are members of that Iranian diaspora feel threatened as well, just as the ones here do in the mainland. When it comes to offering the support and the protection that they need, that will involve the partnership with the Garda Síochána in the Republic of Ireland to ensure that the threat will not come from just within Northern Ireland, could potentially come from the Republic of Ireland. So can the Minister give me and my constituents and those who are committed to a change of the regime in Iran but who cannot return because the regime is so decadent and so violent and so evil?
Thank you, Madam Deputy Speaker. Well, I'm very grateful to him, as I always am. He's got a very long-standing track record of standing up for those who've been persecuted based on their ethnicity or their religion. And I think he raises a very important point about the Iranian diaspora in this country. That is precisely why this government has progressed an important piece of work on transnational repression. We will work very closely through the Defending Democracy Task Force to ensure that all of the necessary protections are in place for those individuals or communities who feel threatened. My advice to anybody who does feel that they are threatened is that they do need to report that to the police. But it's precisely why I've also recently written to all chief constables right around the country to ensure that the training that is available for frontline officers is being taken up by the police forces right around the country, because it's very important that officers on the beat have the necessary understanding about the nature of the threat that many different diaspora communities might face. So I'm grateful to him for championing not only his constituency but the Iranian diaspora, and I give him the same commitment that I've made to other right honourable and honourable members, that this government will work tirelessly to ensure that they are protected.
That concludes the statement, and I'll give the front benches a few moments to swap over. Order. Before I call the Minister to make his statement, can I say how disappointing it was to see details of the India trade deal released to the media a few hours ago, before the Minister came to this House. Minister Douglas Alexander.
Thank you.